Feeling anxious before an exam, a meeting, or a big decision is normal. But what if that feeling never goes away? What if your heart races for no clear reason? Your mind constantly expects the worst, and even small situations feel overwhelming. This is what millions of people experience with anxiety disorders, where the body's natural stress response becomes constant and excessive. So what exactly are anxiety disorders? Anxiety disorders are a group of mental health conditions where fear, worry, or nervousness becomes persistent and difficult to control. Unlike normal anxiety, which is temporary and linked to specific situations, anxiety disorders can interfere with daily life, relationships, and overall well-being. At the core of anxiety is the brain's fear system. A region called the amygdala plays a key role in detecting threats and triggering the fight or flight response. When this system becomes overactive, the brain begins to perceive danger even when there is no real threat. This leads to constant alertness and stress. Neurotransmitters also play an important role. Chemicals like serotonin, dopamine, and gamma-aminobutyric acid, GABA, help regulate mood and calm the brain. When these chemicals are imbalanced, the brain may struggle to control fear and anxiety responses. There are different types of anxiety disorders. Generalized anxiety disorder, GAD, involves constant and excessive worry about everyday things. Panic disorder causes sudden and intense panic attacks, often with symptoms like chest pain, shortness of breath, and dizziness. Social anxiety disorder involves a strong fear of social situations and being judged by others. Phobias are intense fears of specific objects or situations. Anxiety affects both the mind and the body. Common symptoms include a racing heart, sweating, trembling, difficulty concentrating, sleep problems, and a constant feeling of tension. Over time, chronic anxiety can also impact physical health, increasing the risk of conditions like high blood pressure. The understanding of anxiety has evolved over time. It is now recognized as a medical condition involving brain function, not simply a personality trait or weakness. Anxiety disorders can develop due to a combination of factors. Genetics can increase the risk, while stressful life events, trauma, or long-term pressure can trigger or worsen symptoms. Lifestyle factors such as lack of sleep, excessive caffeine, and poor stress management can also contribute. The good news is that anxiety disorders are treatable. Treatment may include therapy, medication, and lifestyle changes. Cognitive behavioral therapy, CBT, helps individuals identify and manage negative thought patterns. Medications can help regulate brain chemistry, while healthy habits like exercise and proper sleep can support recovery. Today, modern technology is helping improve the understanding and treatment of anxiety. Artificial intelligence and machine learning are being used to analyze behavioral patterns, monitor stress levels, and even predict anxiety episodes. These tools are helping doctors provide more personalized and effective care. Anxiety is a natural response designed to protect you. But when it becomes constant and overwhelming, it can affect every part of your life. Understanding how anxiety disorders work is the first step toward managing them and improving mental and physical health.